most living in a modern metropolis, calling an ambulance involves dialing a single short code. But in a city of more than 6 million people, Nairobi has no functioning central emergency number. With 5 public hospitals and dozens of private hospitals and clinics all operating independently, you have to know who to call if you need an ambulance here and hope there's someone on duty to pick up. Caitlin and Maria run a startup in Nairobi, hoping to address this problem.
You just take for granted that 911 exists, and we did as well. Like, both of us had lived here for years and had never even considered it. And we had worked in health, and I had never even thought, what would I do in an emergency? We just started asking people, you know, have you seen an ambulance before? Who has an ambulance? And we would go and meet and find ambulances in parking lots. And we started a really simple tally of how many ambulances could we find. We kind of realized that there's so many ambulances and no one has any idea where they are.
Flair's aim is to connect emergency response vehicles on an Uber-style platform that can route calls to the operator that can get there quickest.
So when the call comes in, I get to know the patient location. I click on the location, get an ETA of all the vehicles that are within my ranger. I can select at our ambulance service, which is 6 minutes away. Now I select on the ambulance service, the ambulance that I'm going to dispatch. Right. It gives me the contact number and their current location and the estimated time. And also it gives me the direct route for them.
And so you've been using this system through states of emergency,
Yes.
for example, the first elections.
Yeah, we used it during the election for 2017. And we had also a backup for the radios, which helped in the emergency services covering all the emergency situations that had arisen. Sorry. Leah, emergency.
A busy city hospital, we left Patrick to his work and headed out onto the streets to see firsthand the traffic problems that make this kind of operator routing a lifesaver. This was especially important when violence broke out during the October elections. Flair's ambulances were 33% busier attending to emergencies in these hotspots.
The response times that we've seen have gone down from 162 minutes, which is the average, which is nearly 3 hours, which is insane, to about 15 to 20 minutes.
So far, the platform has 30 ambulances online, with a goal to reach at least 50 by the end of January next year. An annual membership fee gives patients access to the emergency hotline and covers the cost of any call-outs, which otherwise would have had to be paid by credit card before an ambulance is dispatched. The fee is currently around $15 to $20, but Flair say this might change as the service matures. Eventually, Flair wants to add more concierge-style features for its members, like real-time updates and treatment information. The data being collected might also prove useful to help coordinate better service across the city.
So one of the things that we recently learned is that there's a lack of ambulances between 7 a.m. and 9 a.m. And the reason for that is that the night team is handing over to the day team. And so all providers are doing that shift change. And so then there's kind of a delay in that happening. And so then there aren't enough ambulances online to actually respond to the emergencies.
So you can use that information and go to all of the providers and say maybe stagger your times, right?
Completely. Or make the kind of handover process even more efficient such that that doesn't even occur.
Fire means even bigger problems for emergency call-outs in Nairobi. As well as the fractured coordination issues seen with ambulances, there is a desperate shortage of both trucks and water supplies. Tragedies like this in Nairobi's vast clothes market, Gikomba, are all too common and often left burning for much longer than they should be because of a simple lack of access to resources.
999 goes directly to the police headquarters, to the police control room. So once you call the police control room, it is now there that they start looking for the nearest ambulance service or the nearest fire service. There's no radio linkage, and even the phones that they have, the phones belong to individuals. Fire and ambulance service are controlled separately by different players.
ICT Fire and Rescue is the first firefighting school of its kind in Kenya. I went to visit them and got to try out some training. Flair is working with the school to add as many fire trucks as possible to their Nairobi coverage, as well as locating available public and private water supplies to add to the map.
So there are enough hydrants in Nairobi, theoretically, they were planned for, but a lot of the hydrants have been built on top of. And so we are surveying Nairobi to see where are there publicly available hydrants and then where are there private hydrants that we could actually tap into.
At this stage, it's unclear how the membership funding model will play out for fire cover, as call-out costs could be radically higher and more variable than ambulance work. Flair has high hopes of becoming the 911 equivalent for the whole of Kenya in the future.